Hi everyone. Today is Thursday, October 22nd. I hope everyone had a good Thanksgiving. We have not seen an influx of new cases in Hanna, so I think everyone followed the guidelines really well. For that, I say thank you. We currently have 2 active cases in special areas number 2. Both of these individuals are doing well and are isolating at home. We do not have any COVID-19 patients currently admitted to our hospital, nor do we have any active outbreaks in our facility or in our local schools. As many of you are aware, there was a case identified at one of our local schools, and we are excited to say that there are no cases related to the index cases in these situations. I'd like to say thank you very much to the Prairie Land employees and administrators and the staff and students who made sure to contain any cases and risks. It's a proud moment for our community that we're doing so well. Right now, all of your physicians are healthy and at work, and we are functioning with full services in our community. We are continuing to request that appointments be booked for lab services as well, of course, here at the clinic. X-ray services are offered on a walk-in basis during normal hours up at our hospital. I only received one question this week, and the question says, I have always had a cough and a runny nose and am short of breath due to my pre-existing health. When I answer the COVID virus questions and they ask about it, I try to explain, but people seem to be upset and I'm tired of being left out. What do I do? So what all of the screening questions should be like, including for up at the hospital, is going to ask about new or worsening symptoms, and that will exclude people who have pre-existing symptoms. Certain disease processes like chronic bronchitis emphysema, otherwise known as COPD, as well as allergies, mean that some people have a cough on a semi-regular basis. They clear out their throats in the morning. Other people have a persistent runny nose. When this is a known condition for you, you would simply answer no to that question. This is not a new or worsening symptom for you. This is a pre-existing condition. So you should be still allowed to participate in all of the activities and public events that are available. It's a little bit harder to affect public opinion in that regard, because even as a healthcare professional, I can't tell in the grocery store whether your cough is pre-existing or if it's a new one. So that judgment, I'm afraid, is probably going to exist. Thankfully, in a small town, usually we know most people, and we're able to confidently ask them or inquire about their health if we wanted to at that time. It's also a reminder that for people who have pre-existing conditions, you may feel more comfortable wearing a mask to give a sense of security to those around you, that if you do have the occasional cough and are willing to say that it's because of your pre-existing allergies, it'll still make some people more comfortable. I have heard a few concerning reports about discrimination in our local businesses against healthcare workers who are not choosing to wear masks publicly. At this time, the town of Hanna does not have any particular rules about wearing masks. They have enforced social distancing, requiring you to stay 6 feet or 2 meters away from other individuals that are not in your family unit. And one of the nice parts about living rural is that staying 2 meters away is actually fairly easy to do, other than peak time periods at places like banks and grocery stores. So you may very well see healthcare workers or people from the clinic or the hospital who are out and not wearing masks. At this point in time, that's still their personal choice. They should not be out in public if they are feeling unwell, but please be kind to them as well. You may notice that some of us do choose to wear masks at various times, especially if we think it's going to be a high used time of day, right after breakfast and right after lunch when people head to the stores. And we are welcome to do that as well, any type of face coverings. I think that's all I have for today, so please continue to send in your questions and have a wonderful weekend.